Whether you're fighting, healing, caregiving, treating cancer, or simply searching for hope, this space is for you. Welcome to FU Cancer, where meaningful conversations meet powerful community. I'm your host, a registered dietitian and cancer advocate, and together, we're turning challenges into connection. Check out our platform on the web at fucancer.health.
All right, welcome back to the FU Cancer podcast. Today we're talking about an often debilitating condition experienced by both cancer patients, lymphedema. Hallmark signs of lymphedema include swelling, pain, and limited mobility, all of which make everyday tasks really exhausting for some people. And the changes in appearance can also take a real toll on both body image and confidence. Joining us to unpack this issue is Dr. Chen, a surgical oncologist in private practice in San Diego, California. His clinical practice focuses on breast cancer, melanoma, and endocrine diseases. Dr. Chen did his medical education, general surgery, and critical care training at the University of Michigan, where he also received an MBA. After that, he went to the John Wayne Cancer Institute for Surgical Oncology Fellowship. After time in academics as chief of breast surgery at UC Davis and then at City of Hope as the associate program director of the Surgical Oncology Fellowship, he started his own practice in San Diego. He has been very active in organized medicine, including as past president of the American Society of Breast Surgeons, in committee positions within the American College of Surgeons, Society for Surgical Oncology, and the American Medical Association. His research focuses on quality, cost effectiveness, and outcomes in cancer care in the greater healthcare systems. In addition, he is the chief medical officer of ImpediMed, a medical device company focused on measuring fluid and body composition in the body for a variety of purposes, including detecting lymphedema early in cancer patients, which will be our focus today. So welcome, Dr. Chen. I'd love for you to tell us a little bit about yourself and some of the important work you're doing around cancer care.
Thank you for having me, Shelby. It's exciting to be on this podcast and on the platform here. So basically, besides taking care of patients, which I still love doing, I'm also Chief Medical Officer for ImpediMed. And ImpediMed makes devices that are called a SOZO device, which are bioimpedance devices. They do small electrical current through you, and we can use that to measure fluid in the body in its various compartments, whether it's outside the cell or inside the cell, and if it's in what arm or leg it's in, or in the whole body altogether. And that allows us to measure how much fluid there is related to other parts of the body and related to how we would expect that to happen normally in a person of that size and age and fitness. And given that, we can start to predict things like lymphedema in patients earlier than people can find them clinically. When a doctor looks at you or a physical therapist looks at you, they're not going to find it as early as a bioimpedance machine can.
So we've heard the word lymphedema kind of tossed around today. I'd love for you to kind of tell us about lymphedema and really define what lymphedema is.
So lymphedema, I tell people in very basic terms, is fluid backing up primarily from the lymph system into an area that has been treated or is upstream of that. And so when you think about lymph fluid is sort of like a parallel circulatory system that carries protein and immune cells throughout your body. And that processes through things called lymph nodes, which are these little lumps all through your body that help to inspect that fluid as it goes by and help your immune system to catch things that are abnormal. And that can be infections or that can be cancer cells. And so if you've ever noticed when you have a cold, you get these little lumps in your neck, those are lymph nodes. And those are lymph nodes doing exactly what they're supposed to do, which is examine the fluid, say, that's not normal. Let me recruit a bunch of immune cells and examine this more closely and see if we can figure out how to kill this thing. And it does the same thing for cancer cells when it works well. As part of treatment for cancer, sometimes we take out some of those lymph nodes or we radiate those lymph nodes, or there's cancer in the lymph nodes that we've treated with chemotherapy, and that can damage the lymph nodes. And similar to any plumbing system, if you start to shut off ways for that fluid to go, you can have backup. And when it backs up into, say, an arm or a leg, we call that lymphedema.
Yeah, that's really helpful. So what exactly causes lymphedema, particularly in like the cancer setting?
Yeah, so the most common way to cause lymphedema in the cancer setting is damage to those lymph nodes. And so in part of breast surgery, we often remove some lymph nodes or a lot of lymph nodes. Same thing in melanoma surgery. But even in things like gynecologic surgery, they'll take out lymph nodes in your pelvis, and those will affect your legs. So even when you think about ones that you can't see, they can still have effect. The other time that this really happens besides surgery is radiation. You'll hear commonly, well, let's just radiate this area to make sure. We don't think there's any cancer there, but we're going to make sure to radiate it anyway. That radiation can damage the flow of that lymph nodes and scar those lymph nodes. And just like we were talking about that plumbing analogy, if you take a pipe and you narrow it, you're going to get fluid back up. Now, if your body's got plenty of excess drainage, you might not ever notice it. But if you start diminishing the drainage enough, you'll start to get back up.
And then what would you say are some of the complications that you can see occur if lymphedema isn't diagnosed or addressed or picked up quickly enough?
Yeah. So the ones that people think about are these humongous limbs, and they say, wow, that's really horrible lymphedema. And those people, they definitely get all sorts of horrible things, like between the swelling, they get redness, they can get infections, their skin weeps. In really long chronic cases, you can even get a form of cancer called lymphangiosarcoma, which is exceedingly rare. So I don't want your viewers to worry too much about it, because the odds of anyone seeing it in their lifetime is pretty low, but it happens. But really, the ones that we think about the most are fatigue and this subtle swelling. People just say, my arm feels heavy. I can't get my rings on. My clothes feel tight. Those are all lymphedema that's already to like stage 2, usually, if they're complaining about that, or maybe even to stage 3. And so those are already lymphedema that's hard to get a hold of. And so we want to catch that when we can just measure lymphedema, but you don't feel it yet. That's your best chance at actually turning it around and having it not be a problem for the rest of your life.
So going off that, what point in a patient's journey during their cancer journey would you see a physician, whether it's their medical oncologist, their surgical oncologist, really even educate or inform somebody about what lymphedema is and those risks associated so people can look out for it?
So in a perfect world, you would start talking about the side effects of any treatment you're going to potentially have the minute you talk about you might get this treatment. So if I say, hey, you're going to get surgery, I'm going to take out a few lymph nodes, we should already be having the conversation. When I take these lymph nodes, the consequences might be lymphedema, and this is what lymphedema is. As likely as not, people will mention the word, but how much people educate on it is often they don't educate on it until someone says, hey, my arm feels heavy. And they say, oh, that's lymphedema. I mentioned that to you before. Ideally, we would start talking about it early on so that people would know what they're looking for, and also to start measuring for it. And so the best way to measure for lymphedema is to know where someone starts. In the same way that you would want, if you're trying to see if a kid grows, right? You're gonna measure them at certain time points over time. You're gonna see if the kid grows. You don't just kind of eyeball them later and say, oh, I think you're a little taller. That's good if you're a grandparent, but not so good if you're a doctor, right? You want to know how many inches the kid's grown over a year. And same thing with an arm or a leg. So you're going to want to measure that before you start treatment, ideally, or at least as soon as you can while people don't have symptoms, so that if people start to develop something, you'll see it faster than if you wait. So in our perfect world, you would start measuring basically before treatment. In the real world, I think a lot of people don't get measured until after treatment, and they start to take that big breath that says, I think I'm going to be cured of this cancer. I better figure out what's going to happen with the rest of my life. And that's when they get involved. And while you lose some element there, the sooner you start measuring, the better.
Yeah, definitely the proactive approach versus reactive is always the best, but we know it doesn't always happen, right, in the healthcare world. At FU Cancer, our community really has a huge emphasis on achieving functional status during cancer journeys. So tell us a little bit about how lymphedema can really impact somebody's ability to stay physically active, reach their functional status goals, and kind of achieve some of their health goals.
Yeah, so lymphedema itself, and also the fear of lymphedema, can very much affect people's functional status, because sometimes people don't talk about this because they're afraid somehow that if they tell the patient that they might get lymphedema, that the patient will avoid doing anything with that arm or leg. And that actually happens a fair bit. You hear these stories of saying, well, I was told I should never exercise with this arm, or I should never lift this arm above my head, or I should never get on a plane. None of those are true. We actually know that exercise with some light weights actually improves your chances of not getting lymphedema. But people hear these stories and they don't do it. And so the fear of lymphedema in and of itself can be very debilitating, because in the parlance of, if you don't use it, you lose it. This is a moment. If you don't exercise with an arm, it's going to get weaker. And part of how lymph flow works is your muscles help to push that lymph fluid along. So if you have less muscle, you're going to have less lymph flow. And so you're actually making things worse by not exercising. Once you do get lymphedema, that swelling, that tightness does feel worse the more it hangs. And so people often feel less energetic. They also feel fatigued. And not dissimilar to how people talk about with weight loss, it gets easier and easier to exercise as you achieve your goal weight because you're carrying less weight around. And so same thing in an arm. If your arm is really big and heavy, it's going to be hard to do full exercise. And that's just that vicious cycle of you get behind, you get further behind, and the further behind you get, the worse, the harder your medical treatments have to be to try to get you back to where you are. So.
Yeah, it's like that small, steady progress of things make a huge difference rather than starting at ground zero. Definitely. You've mentioned the SOZO device, which sounds like an incredible option from kind of traditional screening methods. Tell us about how it kind of compares and how traditional screening methods are used in lymphedema, kind of risk stratification and care out in the community setting.
Yeah. So a SOZO device looks sort of like a scale, and you stand on it and you put your hands and your feet on these electrodes, and it passes this very mild electrical current through you. You'll never feel it. You don't worry, it won't shock you or anything like that. And it passes through in various frequencies. And depending on the frequency, that'll go through the cell or around the cell. And by doing that, we can measure how much fluid is in the various parts of the body, inside or outside the cell. And we can also make predictions about how much muscle someone has, the whole body or in the limb. So people can use that to also measure their general fitness as well. And by comparing one arm against the other arm, let's say you're worried about the right arm because you had surgery underneath your right arm, we compare it against the left arm. We say, hey, your right arm is getting bigger relative to your left arm. So people are obviously, depending on what day you measure them or what time of the day you measure them, they're going to be more swollen or less swollen. If anyone's tried to put on socks at the end of the day or at the beginning of the day, you know this is true. And so we actually use that measurement to get a sense of, is this arm getting bigger relative to that arm? And if it is, and if it gets bigger by a certain amount, then we say that's early lymphedema until proven otherwise. If you don't have one of these machines, the most common other way of doing it is a tape measure. You literally take a tape measure, you measure around the forearm, you measure around the bicep, and you use this formula where you assume the arm is like a cone and you measure the volume that way. As you can imagine, it's not super precise in most people's hands because we're not going to always pull the tape measure exactly the same amount each time. Trying to get the exact same spot every time is tough. Yeah, and then there's other ways that we used to do it. We used to, historically, you get a big tank of water and you stick someone's arm in it and you see how much water overflowed from the tank, and that was called the volume displacement method. It's very precise, but as you can imagine, kind of messy, and so not very popular in clinics. But it does work really well. And then there's another device where you can put it in, a bunch of lasers measures your arm and tries to calculate the volume. But again, not a very common thing, but if you might see those happen. But unfortunately, the most common thing that happens is people just not asking or asking maybe very gently, how's your arm feel? And if someone says fine, they move on. And that's probably 90% of how people deal with this, unfortunately.
Yeah, and I can't imagine a clinic having a big pot of water where people are sticking their limbs in them to see the displacement of water. So I'm glad that there's been a lot of advances in medicine, it sounds like, and some adjustments to how we're screening. And it sounds like we have a lot of work to do still in this area, though. So looking forward to some of the advancements as medicine continues to grow. You did mention a couple things around like tape measures and, measuring different body parts in that. And I can imagine for some people that can really impact things like their body image and self-confidence. So how do you help patients and kind of talk people through with some of these changes that can happen with lymphedema?
Yeah. So, I mean, the first thing is to let people know it's not their fault if they get lymphedema. When people get lymphedema, they say, "Oh my goodness, it's because I took that plane flight, or I didn't treat that cut well enough." Because that's one of the things that can incite lymphedema is actually getting an infection. As you might imagine, getting your arm swollen from the infection can incite lymphedema. But by and large, it's not someone's fault. So telling people this isn't your fault, this is what's happening, and we have treatments for it. And the earlier we catch it, the more likely we are to be able to reverse it. So, for instance, in a trial of the SOZO device versus tape measure, what they did was if either one triggered, we put you into 4 weeks of wearing a sleeve and a glove. And a lot of people end up wearing these lifelong because once they have lymphedema, but in this case, for that very early phase, we put everyone in the sleeve for 4 weeks. And we found that the people in the SOZO group, they did not get chronic lymphedema 92% of the time, which was amazing, and about 2/3 less than the group that started treatment once the tape measure triggered. Those people got lymphedema about 19-20% of the time. So 20% versus 8%, that's kind of 2/3. I guess more like 60%, but trying to do fractions in my head is probably not the best way of educating your folks, but there you go. So about 60% less. And that's sort of the thing. We say the earlier you can catch it, the less treatment you have to do to turn it around. And that makes sense for everything. Like you were saying, small steps are easier to have an impact when you don't have as far to go.
So what exactly, kind of going off that, what exactly can people do and what do you recommend to help advocate for themselves in their cancer institutes or with their physicians or medical teams to really ask about lymphedema screening, prevention techniques, and just awareness of this?
Yeah. So I think first is to ask, do you think I'm at risk for getting lymphedema every time you're going to get treatment? Is this going to increase my risk of lymphedema? And while people may say it's not a huge risk, if there is some risk, should say, do you think we should measure me now so that we know what I look like now? And what do you have available to measure me, whether it's a SOZO device or if they don't have that, even a tape measure is better than nothing. Anything's better than just kind of eyeballing someone going, well, your arm looks pretty normal to me. So, but from an ImpediMed standpoint, we'd love it if everyone had a SOZO, and usually insurance does cover having a SOZO measurement. But something to check with their physicians, obviously, and then should be measured periodically after. And so every 3 to 6 months, particularly depending on risk, having someone measure you can be a very valuable thing to catch things early. But then also being proactive about saying, I feel like there's symptoms. And if they don't have the ability to measure you, maybe they can send you a physical therapist or an occupational therapist who can measure. Say, hey, this actually does seem a little large. Why don't we put you in a sleeve? Wearing a sleeve for a month, while annoying, is not as bad as wearing a sleeve for your whole life, right? So,
Sure.
getting in early and getting that 1 month of treatment can sometimes make a difference. And then once it starts to actually build, there are a lot of treatments that can help with the symptoms. We have things called congestive therapy, where it's manual lymphatic massage. There are some advanced microsurgical techniques where people are actually moving lymph nodes from other parts of the body or doing lymphatic bypasses, which have shown some interesting promise. That's not a procedure that just any surgeon can do or even any plastic surgeon can do. But for the people who practice it, they do say that in the right patients, they do get very good results. And the big thing is, just as I think anyone on your platform is not being afraid to ask the question and then ask again and say, hey, look, I am really still worried about this. Is there someone else that I can see that maybe it's not your personal thing, your medical oncologist, and maybe you personally don't treat lymphedema, but is there someone I can see that you can refer me to that can at least give me some education? And that's usually going to be a rehab doctor or a physical therapist who can at least start that process with someone. And so it's unfortunate to have to say this, but you are your own best advocate. You have one person to pay attention to, yourself. And so you know your symptoms better than anyone else. So it sounds odd to say it, but if someone tells you your symptoms aren't real, while that may be true in some objective sense, if you're experiencing the symptom is absolutely real. And you need an answer to why you feel this way. And it can be very reassuring sometimes, though, to get on the SOZO machine and say, you know what, my arm is the exact same size it was last time. Okay, well, whatever's happening, it's not appearing physically yet. And that can actually be quite reassuring.
Yeah, it's just like that objective data, right?
Right. Just like getting a blood count. If someone says, hey, you look pale, and you get a blood count, you say, well, I'm not anemic. So at least it's not that. That doesn't mean you don't look pale, but it's not because your blood count's low. And so, that your arm feels heavy may not be due to early lymphedema yet, or it might be lymphedema even earlier than a SOZO can find it. But it doesn't mean it's not what you feel.
Yeah, I love that. Be
Mhm.
your own advocate and don't be afraid to ask questions and find somebody who can support and answer some of the questions if your provider isn't knowledgeable or they don't have the expertise in this area, which we know not everybody does, which is why it's not happening, right? So
Right, exactly. It shouldn't be an adversarial sort of interaction of saying, well, you're missing my thing.
Yeah.
They may just not be as aware of it or as cognizant of it. And that's okay. In the same way that I do certain types of surgery. And if you ask me about other types of surgery, if you ask me what's the best way to fix my hip, I say, oh, I'm not an orthopedic surgeon, so I know a little bit more than you, but I'm not in any way an expert. And please don't ask me which brand of hip,
Yeah.
replacement you
Sure.
should put in, because I'm going to look at you blankly and say, well, I know there are different types. That's all I know, right? And
Hey, at
so,
least you're honest. Hey, there you go.
right. And so
Appreciate it.
if you approach it that you are a team with your doctor and not
Yeah.
come in and say, well, I know you don't know anything, it's always going to go better, right? Having everyone on your team on your side and really approaching it as a team approach of saying, I don't expect every single person to know everything, and that's okay.
I love that.
Mhm.
So kind of to wrap things up for today, I know there's been a lot of movement in the medical community around lymphedema care, lymphedema recognition. You discussed today the SOZO machine and how that's been used in clinical practice. What it kind of, zoom out at a high level, what do you think are some of the advances or innovations starting to happen in lymphedema care, whether you're seeing it now or you're hoping to see it in the near future that we can look out for?
Yeah, so I think one of the big advances is just this recognition that this and other lifestyle changes can make a big difference in cancer. We had a landmark paper happen this last year in colon cancer showing that exercise actually made a difference in survival, which I think people knew intuitively, but to be able to put a number to it. And in the same way, lymphedema surveillance and baseline treatment has been added to the guidelines in the past few years. Over the past 2 years, we've seen them being added to multiple guidelines saying you should be measuring for this routinely. I think the other thing is over the course of my career is we've gone from we used to routinely take out everyone's lymph nodes, all the lymph nodes under the arm for breast cancer, just because you had breast cancer, to we'll take out some of them. And now we have some papers that say in some people you don't have to take out any of them.
Mm.
And so the best way to not get lymphedema is to have less risk for lymphedema. But even if you take out just one or two lymph nodes, you can get lymphedema. And so going from 2 to 0 is actually a significant advance for some folks. And we see that particularly in small cancers that are low risk, that are especially in older patients where people are starting to skip this. But to the extent that some people are substituting radiation or the surgery, we're not necessarily getting ahead. So it is 6 to 1, half dozen another sometimes. And then also these new advances in surgery for lymphedema, for early lymphedema. I think we're going to figure out who is best suited for those surgeries, and that's going to help for sure as well. That's going to be a multi-year process, but already in large centers, you're seeing these programs pop up. And early results coming out that look really good. And obviously, we're going to have to find out over the course of years who benefits and who doesn't. But for those people who get it, they can sometimes have amazing results.
Well, thank you, Dr. Chen, so much for coming. It sounds like there's been so many great advances just from screening to medical management to surgical innovation coming our way that we can look forward to. Until next time, I'm Shelby Asesko, founder of FU Cancer and the host for today's podcast. Thanks for listening.
The conversation doesn't end here. Join our community today at fucancer.health for trusted education, real community, and resources. We are here for you every step of the way.